Good afternoon, everybody. Good afternoon, everybody who's watching me here in YouTube streaming of MK Education live stream. Today is March 18, 2021, and it's 2 o'clock Philippine Standard Time here from the Philippines. So anywhere you are who was watching to me right now, we will have another topic and we will be talking about Maskne. So if you're not familiar with this word like Maskne, it's a combination of the word of mast and acne. So today, this is very important. The first thing when I did a research earlier today, I realized that it is good to know something, especially in our health, that today we are facing a pandemic time, that today we are facing coronavirus, and all of us are not allowed to go out unless we are wearing our face masks. And those are very important because we are avoiding ourselves to get into or to transmit any types of droplets that would cause a virus later on. So all we need to do today that we are in this present time and we are having this very hard time, especially other people are not familiar with anything that is happening in our society. Will always remember that health is one of the best thing that you could have ever in your entire life. So Maskne, it's a mask wherein it's very important, and then acne, it is a skin allergy. It could, or a little disease in your skin if you are allergic with a mask you are wearing. Okay, so I think it's better to start it today now. So you can see here, this is a girl who's wearing a mask and she has an allergy. You know what? I've known many people, especially girls, because girls are wearing some makeups, and it could have an allergic reaction in their faces when they are wearing face masks. So if there are some girls who are experiencing this today, I think it's better for you to change maybe your face mask. Other people are allergic in surgical masks. That's why they use a cloth mask. Others are in a different types of masks. So as we go along, we will know first what is Maskne and what can we do about it. So we will define first our word Maskne and how would you prevent and how did you get such kind of allergic reactions on your faces. Okay, the first thing, how to avoid mass acne breakouts. Okay, in an effort to slow the spread of COVID-19, wearing a face mask has become part of our daily routine. It's now required in many public places such as restaurants and grocery stores as a barrier against the new coronavirus that spreads through respiratory droplets. So mask is very important nowadays because sometimes you sneeze or you cough, and when you do it, there is some droplets that go along with your sneeze or that go along with your cough. So it could, transmit it to other people or some things. Example, take chair or table, and those people would hold those things and then they put in their mouth. That's a transmission. Okay? Next, if you develop breakouts from wearing a mask, you are not alone. So it means there are many people who are experiencing maskne. This condition known as maskne or mask acne is a common side effect of using a mask. Okay, so it says here that it's not only you. There are a lot of people who are experiencing this kind of problems. Maskne does not simply cause pimples, though it may also result in skin issues including redness, bumpiness, and irritation. If you are concerned about Maskne, read on. We'll explore the potential causes as always to treat and prevent it. Okay, so that's it. As I said earlier, it's a allergic reaction of your skin, or sometimes if you have pimples and you're wearing mask, so it triggers your pimples and it would develop into a little serious allergic reaction. So all you need to do is wash your face and we will know more about that later. Okay, what to know about Maskne skin conditions? Generally, Maskne is an umbrella term for several skin conditions that can be caused by wearing a face mask or covering. It can include. So it means that mostly it could be triggered from mask, because of course one thing that you're using to cover your face or mouth or nose is a mask, right? Okay, so we will know first the vocabularies or the definitions of the following words so that we could go along with its meaning and we will get along to understand all this type of diseases. For number one, acne. Acne happens when your pores become clogged with oil, dead skin cells, and dirt. It can cause pimples, whiteheads, or blackheads. So if you can see there, it's a clog. Sometimes all our faces have pores, of course, but our pores are closed, some pores are wide open. So if they're wide open, it could later on develop into pimples, whiteheads, and blackheads. So we need to be more careful about it. Next, we have rosacea. Rosacea, if you have this, wearing a mask may cause flare-ups. This can lead to pimples and redness. Sometimes you think that it's just normal that you have a red face skin, but if you go deeper into it, it's not. Sometimes you would say, oh, I have only pimples, but if you try to understand what this really is, it's not only an ordinary pimple because it triggered because of the mask or the facial cream you are using. Contact dermatitis. Contact dermatitis occurs when you're allergic or sensitive to the material of your mask. It can result in a red rash along with irritation and blisters. So sometimes do not scratch if you have, I know that red skin, pimples sometimes, it's really itchy. Do not scratch because it will trigger to more infection, irritations, or blisters. Next, we have folliculitis. Folliculitis, or an infection of your hair follicles, causes bumps that look like an acne breakout. You might also experience itchiness or pain. So after you scratch it too hard, of course, it will be painful for everybody who had experiencing this kind of situation. What causes it? Because maskne can involve various skin conditions, the exact cause of your symptoms may vary. In most cases, maskne is the result of clogged pores. You already have oil, bacteria, and dead skin cells on your skin. But when you wear a mask, these substances can build up more and block your pores. So naturally, we have already the oil, bacteria, and dead skin on our faces. But sometimes if we are wearing face mask, it triggered more, it builds up more. So sometimes it could cause a little, different problem in our cases if we are still doing it. A mask also traps humidity due to your breathing and sweating, which may increase the risk of acne. Sometimes, if you are wearing mask and if you have glasses, your glasses become foggy. You experience that. And when you have this mask, sometimes you feel you are not comfortable because you are not used to using mask. So all you need to do is find a suitable mask for you. Okay? Another possible cause of friction: the material of face covering can rub against your skin, leading to chafing and irritation. Or you may be sensitive or allergic to the material of your face covering. Some masks are pre-treated with chemicals or feel rough on the skin. Similarly, wearing a mask that has been washed in a scented detergent may cause irritation. Next one, how to treat a maskne. This one, we already know that maskne develop because of the mask irritation on our skin, and when it develop the blisters, red skin, and you scratch it. So this time we will know how to treat it. Okay, number one, wash your face regularly. During the pandemic, continue following your regular skincare routine to keep your skin healthy. Like during pandemic, sometimes if you are just staying at home, you said, no need to wash your face, like right, or you forget to do it, or you just go directly to bed at night. So always remember, cleanliness is next to godliness. So you have to clean up ourselves, even though we have nothing done that day. This includes washing your face once in the morning, once at night before going to bed. After sweating or wearing a mask, when washing your face, use lukewarm water. Pat your skin dry with a clean towel. Avoid rubbing your skin, as this may cause irritation. Do not rub. As I said, do not scratch. Next, number two, you can do like this. Use a gentle cleanser. Okay, a gentle cleanser can help remove excess oil. There's a lot of facial cream, facial oil. You can buy from pharmacy, or your dermatologist, or recommended by a doctor. Those are, a way to clean your face, to remain, the cleanliness of your face. Sweat and bacteria. Avoid cleansers that contain alcohol or perfume. It's not allowed. Sometimes alcohol, it will trigger more, because alcohol is not for pimples, it's not for cleaning, it's for the wound. These ingredients can cause irritation and make it harder for your symptoms to heal. If your maskne is more severe, try a medical cleanser with benzoyl peroxide or salicylic acid. If you have sensitive skin, ask your doctor or dermatologist about the best type of medicated cleanser for your skin. Do not self-medicate. It's not allowed. Like, you have something in your face and you're gonna say, I can do this, I know what to do about this. No, it's not allowed. You still need to consult the professionals. Okay. Next, use a non-comedogenic moisturizer. After washing your face, apply a moisturizer to keep your skin hydrated. Use a non-comedogenic product, which likely won't block your pores. You know what? I know somebody in my place, like, she's a girl and her face like full of pimples, and then she went to I think beauty salon. Beauty salon, it's not skincare, and not licensed dermatologists. They are just beautician. But she went there and she did like facial, and suddenly that beautician maybe does not know what he's doing or what she's doing, and later on the girl's face got infected. So that's what I'm talking, that you have to go to a licensed dermatologist or your doctor, a professional, so that they could recommend you the best or suitable medication on your face. Because I learned that every face have its different medications. Like this face, maybe this medication is different from this face, because this face is more sensitive compared to this one. Because we are again talking about skin. Your skin is different from my skin, and my skin is different from theirs. So you have to consult the professional. Of course, I know that it costs a lot, but of course you are safe, right? You are safe there. Do not self-medicate. Next, apply cortisone cream and moisturizer with ceramides. If your maskne mostly involves irritation and raw skin, you may want to apply a mild cortisone cream to the area together with a moisturizer that contains ceramides. This can help protect your skin and relieve itching and irritation. Again, be careful, okay? Do not self-medicate. Understand? Okay, take a break from makeup. Usually, of course, we got too much, you got, for girls especially, too much pimples because of the cream makeup you are using. Sometimes that foundation is not suitable to your face. You have to stop. It could cause irritation, it could cause more problems, it could cause more pimples. Okay, stop. Skip the makeup while you're treating maskne. Beauty products such as foundation, concealer, and blush can clog your pores and prolong healing. Always remember, it could prolong healing. So sometimes you get not to understand why I have this pimple for a month. I have this red skin in my face like for a matter of months. You don't know, you didn't get to understand that it's caused because of your concealer, makeup, or foundations. Okay? Again, if you are not that foundation or concealer are not suitable to your face, you have to stop. Okay? So again, those are our topic today about maskne. As I said, maskne is when we go to a recap, that is an irritation of your skin, especially to your face. And I get to know a lot of the girls who have this because usually boys don't have, because boys just, of course, we're not using makeup or something, and maybe we are not really that prone compared to girls to have this maskne or acne or any irritation, because girls, of course, they're really very when it comes to their face, they are doing very well. I mean, they spend too much money, they exert too much effort, they bought too much, beauty products just for them to look presentable, for them to look beautiful. But if you come to realize, sometimes you need to know that, of course, face is very much important, but you have to know that what kind of beauty products you are using, right? And how to apply it properly. Sometimes we get a chance to buy a lot of beauty products, and then we think that beauty products are all the same. Like, you can use this, you can use that. But if you get to understand, no, they're not the same. Like, this beauty product has more PF compared to this product. This product is less in reactions compared to this product, right? And you have to be careful if that product is very cheap. Yeah, it's cheaper, you spend less, but later on, maybe you will experience the effect of it, that it's so dangerous on your skin. Okay? Again, you have to choose the best beauty products where it's suitable to your skin. If you are not sure, there are many dermatologists, there are many people to talk about that. Okay? Okay, so thank you very much, everybody, and see you again tomorrow for another video stream in this MK Education Line channel. Thank you and have a good afternoon.